Hello, everyone, and welcome back to the Pharma Mind. In today's session, let's take a closer look at the condition that's often ignored and misunderstood, diarrhea. So first, medically, diarrhea means passing loose or watery stools at least 3 times in a day. But the real importance lies in understanding why it happens. The most common cause is infections. Bacterial agents like E. coli or Salmonella, viral agents such as rotavirus or norovirus, sometimes parasites. Beyond infections, there are other triggers, food-related causes like contaminated food or water, and intolerances to lactose or gluten. Medications, especially antibiotics, which can disrupt the normal gut flora. Other causes such as stress or chronic conditions like irritable bowel syndrome and inflammatory bowel disease. Now, what are the symptoms of diarrhea? Apart from loose stools, patients often present with abdominal cramps, nausea, vomiting, or fever. But the most critical thing to assess is dehydration. Look for a dry mouth, dizziness, and reduced urine output. These are red flags that need immediate attention. So, how is diarrhea managed? The first and most important step is rehydration. Oral rehydration solutions, clear soups, and broths are highly effective because they restore electrolytes. Patients should avoid sugary drinks, caffeine, and alcohol as these worsen dehydration. When it comes to diet, the focus should be on easy-to-digest foods, bananas, rice, toast, and clear soups. Spicy, fatty, or heavy meals should be avoided until recovery. And what about medications? For adults, antidiarrheal drugs like loperamide can be considered, but only if there's no fever or blood in the stools. For children, zinc supplements are recommended as they help reduce the duration of illness. Antibiotics are reserved for confirmed bacterial infections. If you found this helpful, don't forget to like this video, share it with your friends, and subscribe to the Pharma Mind.